Okay, so after the approach, you'll do the screening, which we talked about. And at this point, we will go to the database and I will show you the screening process as well as the approach and introduction all the way up through the end of the screening. The first thing you'll do to enroll a participant in the Women's Health Study is to log into the Women's Health Study database, and you can access it from any device. You'll have a study laptop and a study iPad that you can use, or you can access it from any device that you need to. You'll have your own unique username and password, and I'm going to go ahead and enter mine in right now. And once you do that, it'll take you to the main home page of the Women's Health Study database. Now on mine, it shows all of the different sites. On yours, it'll just show your particular site that you'll be using. So to enroll a participant, you'll go up to the Participants tab and click on Screen Initial Wave. And then once you do that, you'll click Start Screener. Once you start Screener, it will generate a participant ID for you up at the top left of the screen. And you'll also answer a few questions that are just basic information about you and about the patient that you're about to approach. So I'll go ahead and put in my initials here. And then the date of initial evaluation is the date that the person presented to the SANE for care, and today's date is highlighted here. The time of presentation is the time that the person presented for care at the SANE. So not the time that the RA was called and not the time that the RA is completing the screening, but the time that the person actually came in. And you can probably find this in the medical record. It's important to note too that this is in the 24-hour clock format. You'll also enter the patient's date of birth. And then there's one screening question before you move on, which is the potential participant female? And all participants in the Women's Health Study must be female. This next page is the quick screen page, and for general purposes, if you're just enrolling a participant, you'll always click Maybe Eligible. There may be other times that you'll use this page in a different way, but if you're trying to see whether someone is eligible for the study, you'll click Maybe Eligible and move on. Once you've done that, the database will route you to a series of scripts that you'll read and ask questions of the participant in order to find out whether they might be eligible for the Women's Health Study. And the great thing about the database is that it basically takes you through from start to finish without you having to access any other documents or any other notes. It's all right here for you, and it should be pretty easy to use. You can see here that these scripts are written in a certain way. You can definitely feel free to add your own spin or your own style to these, but the most important thing is to make sure that all the information on the page is conveyed to the participant so that you can make sure they have all the information and that all the questions that we need answered are asked. So if I were reading this, I would say, "Hi, I'm Sarah. I'm with a team of sexual assault experts and advocates from UNC Hospital and the University of North Carolina. We're doing a study to learn more about the recovery process after sexual assault. Is it okay if I speak with you for a few minutes?" And again, you can see that I read that verbatim, but you don't necessarily have to. The most important thing is that we're trying to standardize across study sites, and so reading the scripts just makes sure that you're doing it the same as an RA anywhere else in the country would be doing it. So I'll go ahead and click yes here. This next question just asks if we can call the person in a couple of days to explain the full study to them. Today we're only asking them to participate in a very small part of the study, and later we'll ask them some follow-up questions, and so we want a chance to call them. If they're okay with this, then you can move on to the next. The next section explains that as part of the study we'll be collecting a blood sample. The reason we ask this early is because we want to make sure that if the person isn't willing to provide a blood sample, that we don't go through the entire screening criteria section, just so that it saves you time. This section shows a little bit about how the blood sample will be used, and we'll go into greater detail on that later down the road, but this is sufficient, just explaining that the blood sample will be used to understand how the body recovers after assault, and that we won't label the sample with any information that would identify the person, and we'll even destroy the sample if they decide not to come back for the 1-week assessment. If the person's okay with the blood sample, then they're still eligible for the study and you can continue. The next section is where you'll ask the person if it's okay to ask them the eligibility criteria questions, which brings you into the eligibility criteria themselves. Some of these are really straightforward and you may be able to answer them without the participant or without asking the participant. Some of them you'll have to ask, some of them you'll already know, and some of them have sort of particular definitions, and I'll point those out as we go through this section. So is the potential participant 18 years or older? You'll already know this from the medical record. And did the potential participant present to the SANE less than 72 hours after assault? You should know this as well. Will the potential participant receive a SANE exam? So the person has to have consented already, or you're reasonably sure that they will consent to the history and physical portions of the SANE exam. We don't need them to agree to all the evidence collection or anything like that. We just want to make sure that the person will consent to the history and physical. And if they don't, for whatever reason, end up consenting to those after you've already enrolled them, it's okay. You can just let us know. Is the potential participant alert and oriented? This just means is the person clinically sober. So it's okay if they have a little alcohol in their breath, but they can't be intoxicated. And so the general rule of thumb is that if they're able to consent to the SANE exam, they're also able to consent to the study. But this, you'll have to use your judgment and talk with the SANE nurse as well. Is the potential participant a prisoner? So the person just can't be incarcerated or about to be incarcerated. You'll know this pretty easily from the get-go. Is the potential participant pregnant? This question asks whether the person is known to be pregnant. So you don't have to wait for a pregnancy test to answer this question. If you're reasonably sure that they're not pregnant, they don't look pregnant, they say they're not pregnant, go ahead and enroll them. And if we find out later that they were pregnant, then we can always exclude them later. And actually, since that happened, this is a good time to point out, if you do answer one of the eligibility criteria questions in a way that makes the person ineligible, the database will give you instructions for how to move forward. So in this case, it tells you they're not eligible, and that if that's incorrect, you can go back and change your answer, which I need to do. Or if the person is ineligible, then you can read this script down here that thanks them for participating and lets them know that they're not eligible, but that they've still helped us help advance the care for other survivors in the future. But again, the answer to the pregnancy question is that they cannot be pregnant at the time of initial assessment in order to be eligible. Does the potential participant live with the person who assaulted her? So this question, the way we've defined living with the person is that they have to be not currently living with the person who assaulted them. So if they used to live with them but they don't anymore, that's okay. However, if they are currently living with the person, even if they say, oh, but I'm going to move out, this is considered currently living with, and so the person would be ineligible. For this case, we'll say that they do not live with their assailant. The person can't have any fractures to be eligible for the study, and they also have to be clinically stable, so not likely to be admitted to the hospital. And again, we can't always foresee whether this is going to happen, so if you're reasonably sure that they're not going to be admitted, go ahead and enroll them. But if you think that they might be, or if it looks like they will be, then you can exclude them. Does the potential participant speak and read English fluently? The reason for this question is we want to make sure that the person can answer the follow-up questions when we see them later on in a way that is independent and allows them to answer the questions privately. And so if someone doesn't speak or read English fluently, then it will be difficult for them to do this. We are talking about both participants who perhaps English isn't their first language, or participants who you're worried about their reading ability in general. So there's a little script at the bottom where you can ask if you're concerned about it, but the reason is just to protect their privacy and keep them from having to answer these questions out loud. Does the potential participant have reliable access to a phone? The reason we ask this question is the person doesn't have to have their own phone in order to participate in the study, but they do have to have access to a phone where they get their messages regularly, and also they have to be able to make outgoing calls on that phone on a regular basis if they need to. The other thing that we are excluding is if people have had 3 or more different phone numbers in the last 6 months. So if they use pay-as-you-go phones and they've changed their number a lot in the last 6 months, they're also ineligible. The person also has to live within traveling distance at least for the 1-week assessment, because that one happens in person, and you'll have to use your judgment on this. If the person says that they live 10 miles away, that seems pretty reasonable. If they say that they live 100 miles away, you'll have to kind of consider what sounds reasonable, and maybe they're in the area a lot, or they have really reliable transportation, and that would be possible. But just use your judgment about this one. If they don't live within traveling distance, they would be ineligible. The next question is about the follow-up interviews and whether they live within traveling distance for those. So if they live within traveling distance, that's fine, and you can click yes. If they don't live within traveling distance for the 6 weeks, 6 months, and 1 year, so for example, they're planning to go on an extended trip or move, it's okay. They can complete those visits online, but if you answer no to this question, they have to have access to the internet and an email address in order to be eligible for the study. If they have those 2 things, they're still eligible. Does the potential participant have a place where she can receive mail? And this can include their own address or someone else's address where they're both able to receive mail and also are comfortable with study-related mail going there, and it can even be a P.O. box. The study correspondence will never have anything related to assault. It'll never say the name of the site where the person was seen. So it is pretty private. We just say that the women's health study is where we're writing from. And so they just have to be comfortable with that kind of mail going to this address. Hopefully the answer to the blood sample question is yes, because you've already asked it earlier. So the script is down here at the bottom if they have additional questions about what we'll be doing with the blood sample that you can use to answer if they have questions. If the answer for whatever reason at this point is no, you can go ahead and click no, and it will bring you to a follow-up question that asks whether the person would have been eligible at the 1-week follow-up. However, this does not make the person eligible for the study. So whatever you answer to this question about the 1-week follow-up, still the person is ineligible. We just want to collect that information for the future. So I'm going to go ahead and go back and say that yes, the person is willing to provide a blood sample just to keep moving forward. The last question is whether there's any other situation that would make the participant unable to follow the study protocol. And this question is for anything that you just think would be a red flag and potentially the person wouldn't be able to follow the protocol, but it's not really covered in any of our other eligibility criteria. So for example, if you're worried about someone because they were really disengaged during the screening process and you don't know that they would be a reliable source of information, or you're worried about someone's cognitive ability and their ability to follow up and answer all the questions and understand all of the questions at the follow-up assessments, that would be something you could document here. So if you do answer that yes, there's another situation that would make the participant unable to follow the study protocol, it takes you to a page where you can document the reason, and just make sure you're really specific here about why you're marking them as ineligible. But if you don't see anything out of the ordinary, you can go ahead and click no here, and it'll take you to the decision page. And the decision page just asks you to indicate whether the person is eligible and volunteers to participate, or is eligible and now refuses to participate. Once you get to this page, you know that the person is eligible for the study. At this point, if the person refuses and you click on refuse, it takes you to a list of refusal reasons, which you can ask the person. If not, if the person volunteers to participate, and we'll do that just to be able to move forward, it takes you to the consent page, which is the next section.